Hello everybody, this is Gary. Today is March 9th, 2022. It is 5:13 p.m. Eastern Standard Time in the United States and Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today, my right knee is in a lot of pain again. I did a lot of walking today. I went to several appointments. I had to go out shopping, and walking around on my right knee is causing me a great deal of physical pain. The pain tends to flare up, then go away, then come back again. I'm scheduled for an MRI on my knee on the 24th of March. We already did an x-ray of my right knee, and there is no fracture or dislocation of the bones or joint, but there may be tendon damage, cartilage damage, or soft tissue damage that will only show up on an MRI. So right now I'm limping around my apartment because it hurts like hell. But as far as the other physical pain in my body, that's not severe. That's at a minimum. I just did my physical therapy exercises earlier this morning. I exercised on my indoor exercise bike for an hour. I'm sticking to my daily schedule. I saw my psychotherapist today. We just talked about how things were going with my anxiety, my depression, particularly my paranoia, which has gotten worse over the past few days, my delusions, which have gotten worse over the past few days, and my hallucinations, which have gotten worse over the past few days. My anxiety levels are pretty normal at this point. Can't say that my anxiety is all that severe right now. But my paranoia is pretty intense. I went to group therapy yesterday, and I talked about my paranoia and my delusions and my hallucinations and my depression and my anxiety. I did a 10-week block of group therapy sessions. We're going to have the last 10th week next week, and then we're going to do another 10-week block of group therapy sessions for what's called DBT therapy, dialectic behavior therapy, which is a form of therapy to help people withstand high amounts of distress and stress, both internally and externally, both caused by mental illness and those caused by outside environmental factors. That's the short definition of dialectic behavior therapy. Tomorrow I'm seeing my psychiatrist. We will be talking about and going over all my medications, including the fact that I'm on Cymbalta, and how it's working for helping control my physical pain. My psychiatrist is not the one prescribing the Cymbalta, even though it's an antidepressant, because I'm not taking it as an antidepressant. I'm taking it for physical pain. My primary care doctor is prescribing the Cymbalta. I will be seeing my primary care doctor, I believe, on April 6th next month. I have a couple other medical appointments coming up. I will be seeing the orthopedist in April. I will be seeing the radiologist on the 24th for my knee. I have several dental appointments that I'm going to have to keep because I went to the dentist on Monday. They took x-rays. They want to put crowns on my front teeth because my front teeth are grinding down. They also want to give me dentures because I'm missing a lot of teeth. They cleaned my teeth and they brushed my teeth. And so I have a lot of dental work that I'm going to have to get done over the next month or two. But as far as my psychiatric symptoms are concerned, they're more severe. Like I said, the paranoia and the delusions are more severe. But I have my behavior under control. I'm not suicidal. I'm not violent. I'm not dangerous to myself or other people. If I thought I was, I would go to the psychiatric emergency room. Speaking of which, I haven't been to the psychiatric emergency room since October 30th of last year. So that's November, December, January, February, March. More than 4 months ago. which is pretty good for me. That sets a new record for me for not going to the psychiatric emergency room. But I'm not feeling suicidal, I'm not feeling violent, so there's no reason to go to the psychiatric emergency room. Um, it's about 5:17 p.m. right now. In a little while, I'll do some meditation. I'll take my Zyprexa and Klonopin and do some meditation. And later on, I will take my night meds. I'm still taking Neurontin to help control the physical pain, the Flexeril to control muscle pain and spasms, Tylenol, and I leave for pain and joint inflammation. And I'm still taking laxatives because my psychiatric meds all cause constipation. I have had to go to the emergency room before for a severe constipation, for not having a bowel movement in several days. That can be a dangerous situation. I've also been to the emergency room because of the inability to urinate. Ultimately, we did prostate surgery, and we did surgery on my urinary bladder, so I could urinate on my own again without a catheter and a urinary leg bag. That problem's been solved. I'm just taking it one day at a time. And that's pretty much all of the report for now.